first year out of uni, you want to be making sure that you're doing your class 2s perfectly. You want to be able to do quadrant dentistry, your isolation, your rubber dam, your posterior composites. You want to start feeling confident about this stuff before you kind of, expand your toolbox. And it's very common that we don't have to be everything. You don't have to be the perfect practice owner / specialist or / super GP. You can be one and not the others. The thing that kind of drive me towards wanting to become a specialist, I really like the presenter. Like, I really have this kind of sweet spot for specialists when they talk, because you really feel how they, not just that they enjoy what they do, but how much they know as well. So the knowledge that they were able to show in those CPD courses made me always think I'd love to be one of them. In my head, it's always about the balance. Success can be your patients, busy being seeing patients, your business, your family, your personal life, and
but what's success for you?
Your headspace. Yeah. For me, it's a balance of all this.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. Hi CPD Junkie fam, I'm your host Laurence Doan, and today we're joined by Dr Hossam El-Haddad. He graduated from Cairo, Egypt in 2006 before relocating to Australia in 2010. He obtained a fellowship in the RACDS in 2015 and graduated with a DClinDent in Pros from Melbourne in 2018. He is a lecturer and a clinical supervisor at the University of Melbourne's Dental School, where he is a coordinator of the implant component of the DDS students and the academic lead of the CPD. He further serves as a reviewer for the Australian Dental Journal, a committee member of the APS, and is currently the Victorian representative within its federal committee. Dr. Hossam, welcome to the show.
Thank you. Thanks, Laurence. Thanks for introducing me.
So, yeah, you briefly were in Egypt. Can you tell us about that time and that process and what ultimately led you to coming to Australia?
Yes, of course. So I'm Egyptian born and raised, lived in Cairo my whole life. And so I finished high school and joined dental school. Unlike Melbourne University here and back home, you can actually go directly from high school to dentistry straight away. It's not a postgrad degree. Did my dentistry, did my internship here. And I think in my third or fourth year, I probably kind of had in mind that I would like to make a move somewhere. At that point, it was in Australia. I have an older brother who lives in England. He's a surgeon, and I thought at that point that I'm just going to be joining him over there. I finished my dental degree, and I started looking into countries that would take me, basically. And he got me to speak to a few dentist friends of his in the UK, and I realized that there's actually a lot of dentists from the UK who are kind of jumping the ship and jumping NHS and moving to Australia. So that was straight away, that's okay. And Australia was one of the few places where it was, you do an exam, you pass the exam, you get accredited, and you can start working. Unlike the US, for example, where I had to go through uni again if I wanted to practice over there. So that kind of made the decision for me. It wasn't a long stay in Cairo after I graduated. So I did work over there for 2 years. I finished in 2006, as you mentioned, and I came to Australia in 2010, and I was already sitting for my exams, the ADC exams, Australian Dental Certificate exams. For your listeners, I'm pretty sure we've got a lot of overseas dentist listeners. So I did my ADCs in 2008 and 2009, and then I moved here in 2010.
So how was that process when you joined the ADC? Because from what I've heard from everyone, it's pretty difficult, and especially when it's a bit disheartening when you may not pass the first time as well.
Yes. Look, I got to be frank. My heart goes out to all people who sit for ADCs. It's not the easiest. It's not easy from the exam point of view, like the theory, the hands-on, the OSCEs, all this kind of stuff. But there's a lot, as you said, there's a lot hanging on stake basically, because you're coming from the other side of the world. In my case, there's a lot of time taken off work in preparation to that exam. You're leaving your family, your friends, your support group, and you're investing a lot of money in it. And then you come and sit for an exam, and generally at that point of time, this is all what you can think of. I want to pass that exam so I can make a move and start in my career. Yeah. And yes, it is disheartening when you hear about people not working it out from the first go. And I also got to come clean or put it out there. I passed my part one from from the first go. Like that was the theory part. Again, the ADC exam kind of changed in how it's set up. Nowadays, it's different to when I sat it 15 years ago. God, that's a long time. But yeah, so it was a theory part. It was a written. So that written part, you can actually sit. They had a few centers. One of them, fortunately, was in Cairo, so I didn't have to travel for that one. And then the second part, which is the hands-on part, in my time, that was a week-long exam. So it was good 6 days back to back. You've got your exam going on from 9 to 5 every day with different exercises and different vivas and stuff like this. So it wasn't the greatest experience in terms of the pressure that is generated by the exam. By the third or fourth day, all you can think of are the mistakes that you've done in the past 3 or 4 days. And by the third or fourth day, it's like, I just want out. I just want to go home. I had to come back and resit my perio. So I passed everything but perio. I had to come and sit the perio again 4 or 5 months later, which is again an extra expense. Again, a bit of pressure because you pass the perio, you've done it. If you don't pass the perio, you go back and repeat the second part you repeat the whole hands-on again. So again, the pressure that is there. The exam changed a little bit right now from what I hear. It's OSCE based. It's over 2 days instead of a week. But the pressure is the same. Overseas dentists, as I said, there's a lot of investment, time and money, and a lot hanging, and their career is kind of put on pause until they pass it. The thing that put me through it was how much you wanted, how much I was keen to make the move. And I think that was the main push that kept me going. So even though I wasn't fortunate to clear everything and had to come back to sit for the perio, but at least wanting it and seeing what I would be living and being keen to make that move, I think that all kind of pushed me to just kind of, persevere with it. What I would say for people who are also sitting for exam, just keep going. You will pass it eventually. It's just a matter of understanding the system, understanding how it works. The OSCE setup for exams is not something that at least I wasn't very aware of or very trained for in my time. So again, once you sit it once, your second time, if you have to reset it again, will be very different. There's a lot for you to learn from just the one experience.
And so did you lean on other people prior to going to sitting these exams? Or I don't know, because obviously you're in a foreign country, you don't have the contacts per se, it's hard to find,
No, totally. Look, you've actually hit the nail. And as I said, when I was saying how I chose Australia because England was a bit too, people were kind of jumping the ship, as I mentioned. One main reason for coming to Australia was I knew people who passed the exam. So it's been done before, it's been tried, tested, and I've known people who have made the move. So I had a lot of contacts and a lot of very nice reference group that I was leaning on, as you mentioned. Happy to sit with you, discuss things, long distance phone calls. Zoom wasn't there at that point. So I'm in Egypt talking to people in Australia, telling me about your experience, so on and so forth, and passing on resources. So I remember I had some, and again, makes me sound old, but we had a lot of printed out, materials and stuff. And I would find people's name written on it. And I didn't meet those people until I came to Australia 5-6 years later. We come across so this person, it's his name on those resources that I was studying from. And then I meet them in the same both countries, just different cities. Yeah. So it was very helpful. And I think we all kind of, without saying it, was kind of an unsaid agreement that we're all paying it forward. They got help from someone to pass the exam. They did it for me. I've done it for the people after me, and so on. So it's kind of a nice cycle to go through. You get help, but then you help others afterwards, and all for the reason of helping people move on with their lives and move on to the next place and pursue their career the way they want.
Yeah. That's an incredible story. Just when you mentioned your brother, I know that you did treat your brother at one point, didn't you? When you were visiting the country, you guys met up, and now he's married and everything, isn't he?
So my brother has he's finished med school in Egypt, just like I did dental school, and then he moved to the UK. I'm the only dentist in my family, which means that whenever I go back home, I actually take my loops on with me. because I know that I will always be treating someone.
Someone's going to tap you on the shoulder.
So and I've got very nice friends back home that are willing to offer me the dental practice to work out from. Not that I kind of see patients, but I at least see because I go to Egypt every year. I try to go every year and visit the family. So I always go. I'd always be doing the checkups on my mum and sister, and then if my brother needs some work because he lives in the UK, he would always wait until I get to see him, and then we do a bit of work on him on that point. But yes. So it's always like my wife laughs at me because I would use her help. She's non-dental, okay, and I'll be home. I'll be taking my brother to a friend's practice, and I'll ask my wife to come and nurse for me. So she gets a bit excited. She gets a bit of kick out of it. But yeah, she's very helpful at that point.
Okay, so I'm gonna fast forward back. Okay, so you passed the ADC exam, but is it that you make your way to Cairns?
Yes. So that was my first job in Australia. So I'm in Cairo still. I passed my exams. I want to make the move, but I don't want to come to Australia without a job kind of sorted out. Because you never know how long it's going to take you before you land your first job. Luckily, at that point, there was this corp called 1300 Smiles. They were happy to do over the phone Skype at that point, interviews, and happy to seal the deal while you're still overseas. So that was my first job. I went from Cairo, landed in Brisbane, and then Brisbane to Cairns, and I spent a year over there. And it was again my first experience in Australia, so I'm still getting used to the dental system, item numbers,
the weather,
and the weather was a big deal because I come from a desert country. It's kind of dry, and I'm landing in Cairns in December or November, I reckon. So it's full on, humidity, wet season, lots of rain. I mean, it rains in Cairo, but you just get a little bit of spitting, and that's pretty much it. And then suddenly I'm sitting there in the balcony watching a thunderstorm and all the rain, and just I'm in awe, but how different the weather is. But it was really nice. Like, I know I'm sure a few of your listeners have been to Cairns before. Beautiful place to live in, beautiful nature. And I was very lucky with a bunch of people I was working with as well. So I spent a year over there that I really, really enjoyed. Learned a lot about the system. And because over there I was working in private practice before I made the move to Melbourne, because at that point I felt, as much as I loved Cairns and I still go there on holidays, but the chance for continuing education was kind of limited. It's different now because now they've got a university, they've got a dental school set up there. But when I was there in 2011, it hasn't happened yet. So the chances of CPD and continuing education was actually quite limited.
Yeah. So, well, let's dive into it. So you decided to move to Melbourne because you wanted more CPD opportunity. So what did you kind of dive straight into at that time?
Well, I at that point, again, I consider myself still at that point a fresh graduate, even though I finished 2006. But I came to Australia and it's a new place, so I was considering myself then as a fresh graduate, my first year in Australia, and so I was kind of keen on everything and anything. I was doing the endo, the ortho, the pros, kind of taking it all in. And that was, as I said, that was the main reason for why I moved. Because
I noticed you didn't say perio.
No, I didn't. kind of says something, yeah. Yeah. Look, it's and maybe I found my calling at some point, but I think it takes some of those courses to realize that I enjoyed this one more than that one, or I really took on a lot from this course, and I went on a Monday, quite excited to implement the first thing that I've learned from this course, unlike that one. And I found my calling from pros that way. I did as much, again, hats off to our orthodontic colleagues, but I did a long orthodontic course that was kind of part-time over 2 years. And I think halfway through, I realized this is not it, this is not what I want to do. And I still continue with it because, you're committed. But that was one of the first things I was happy to drop and not have to deal with when I decided I want to go into specialist training. but I came to Melbourne and I took it all in. I love the culture, I love the coffee, I love the weather, and I love the opportunities of CPD. The closeness to Melbourne University was a big kind of plus. I think the first thing I signed up for was the surgical course that Melbourne Uni runs through the HSV. So that was the first thing that I signed up for coming to Melbourne. I even signed up for it while I was selling canes. They still run it, and it's a very popular course. And you gotta put your name on the list quite early.
I mean, why was that particular course the one that struck to you to go gravitate towards first?
So I was in Cairns. Cairns at that point had a lot of general dentists, and there was just a couple of specialists. At that point, I think it was only a periodontist and a surgeon that was there. That was a long time to see, like a long waiting time to see either of them. And I remember getting stuck with a couple of extractions, and it kind of hurt my ego a little bit. So knowing, and again, that it couldn't have been a problem maybe coming here to Melbourne, a lot of more pool of specialists to choose from, and probably the patient would be seen faster or earlier. But in my case, I think because I got stuck, so I had the experience of getting stuck and sweating, looking at the patient, looking at that kind of remaining root that you're not able to retrieve. I think that was the one thing that I really wanted to work on, and so that was one of the first courses that I signed up for.
I see. So you guys, basically the type of courses you were picking were based around the type of work that you might have been struggling with. Is that what you're saying? And
I think it's yes. Yeah, because I think this is a very kind of easy way to direct your learning. Okay, we can sit back and say I want to learn this, and this, but then what? But then once you want to work your priorities, you got to start thinking about the patients that you see the most, and what sort of clientele they get to see, what sort of work do you do on day-to-day basis, and this is the first thing that you want to work on and basically make better before you jump onto the next part of dentistry, or the next thing is to just work on what you do the most and make it and try and do the best of it, and then moving on from there.
Yeah, because a common question I ask guests is, what kind of advice they would give to someone who's just starting out the dental education. So, to your point, yeah.
And I always, because I get that questions a lot. You've mentioned I'm kind of involved with a bit of teaching DDS3, and so I still stay in contact with the DDS4 students, and I get that question. And the thing that I tell them is like, make sure that your bread and butter is spot on. So I mean, at some point you want to do implants, you get to do implants, but really the first year out of uni, you want to be making sure that you're doing your class 2s perfectly good. You want to be able to do quadrant dentistry, your isolation, your rubber dam, your posterior composites. So it's this bread and butter that you'll be doing a lot of in the first year. And you want to start feeling confident about this stuff before you kind of, expand your toolbox and incorporate other treatments that you can provide at the same level.
So, okay, carrying on from there, at some point you're working in Melbourne, for everyone else, they reach a point where they start to contemplate practice ownership, being a specialist, or being a super dental GP, or even starting a family. What are your thoughts on that? And how did you decide?
I'll tell you my story. I mean, every story is different here, because we all have different, your partners, the practice you're in, the opportunities that you come across. So
that's right.
My story is could be a little bit different than others. So I kind of knew from the get-go that I'm maybe not the best businessman. Okay, and it's very common that we don't have to be everything. You don't have to be the perfect practice owner / specialist or / super GP. You can be one and not the others. And I think it's important to realize early on what part that do you really enjoy. Some people really enjoy the managing of things, and they're happy to kind of jump into ownership and then have people working for them while they kind of manage things and set up the perfect environment for the people to work at. It's not for me, and I kind of realized that early. And I'm, again, hats off to people who manage practices or manage even multi-location practices. They're doing an incredible job that I don't know how they do it. I find myself the happiest in a chair with a chair put back and a patient there, and I'm looking inside the mouth kind of thing. And so that in my head early on, after a couple of years of working, I realized this is my happy place and this is what I want to pursue. So practice ownership at that point was was not really one of the options that I was up to consider. At that point, I would go to a CPD event, and if it was delivered by a specialist, and my wife can vouch for that, I would come back and tell my partner at that point, she was my wife then, but I would tell her, I really like the presenter. Like, I really have this kind of sweet spot for specialists when they talk, because you really feel how they, not just that they enjoy what they do, but how much they know as well. So the knowledge that they were able to show in those CPD courses made me always think I'd love to be one of them. And I think that was the thing that kind of drive me towards wanting to become a specialist. Having said that, that is a decision that you or anybody else have to run with a partner. If you and I think it applies to anything. Even if you're going to set up practice and become an owner, you still need to run it with your partner, because it's a lot of commitment, and it will take a lot of your time and a lot of your brains, and you'll be sitting there and in person, but you're thinking about something else. And then my wife can tell straight away, you're not listening to me anymore. You're thinking about something. So yeah. So I think in my case, I realized I can't, or I don't have the skills for ownership. I would like to become a specialist because I had a lot of appreciation to what they do, and it was just about finding the right time. At that point, me and my partner, we've met. We haven't got married yet. We've met, and I told her I would love to be a specialist, but that means 3 years of full-time studying. So basically, puts whatever plans we had for ourselves puts a little bit later. And I'm lucky that she was very supportive. I think she might have felt it, how much I was talking, how much time I was spending going to CPD courses or talking about specialists. So she felt how committed I'll be and how keen I am. And so she was very supportive, and for that, I'm very thankful for her.
So, okay, so to line up in the process of preparing for the specialist program, you obviously did some primaries.
Yes. So I did at that point, actually, I'll go a little bit back. When I decided to do the primaries and the fellowship, I actually wasn't thinking about specialty yet. Okay. I just wanted to, it's something more to add to your CV. It's a bit more learning. It pushes you because, there's an exam, set a date. So it pushes you to do a bit of reading and be a bit more updated. So that was when I actually kind of went onto that venture. However, I'll come clean. I wasn't so keen on doing the primaries because of all the basic sciences in there. At that point, there was a little bit of not a loophole, but basically if you've done the MJDF, the membership of the Joint Dental Faculties of England, if you've done part 1 of this, you don't have to sit for the primaries. You can go straight away to the final exam. So I did this because the MJDF exam was more dentistry based than it is kind of basic sciences like the primaries. So I've done that one, and then from there I went and did the final exams for the fellowship.
Yeah.
I think that was very helpful in getting your CV up and ready for the year after when I applied for the specialty.
Yeah. And you did those 3 years apart, right? You did that early on when you came to Australia, right? And then following that, you did the fellowship after that.
Yeah. So I think the MGDF was I think 2013, and then 14 I sat for the fellowship. I didn't pass it from the first go, and then 15 I passed it. And then 16, I started my specialty training. So yes, it was over a period of time, and my mind was changing. So as I said, when I did the primaries or the MJDF, I wasn't aiming for specialty at that point. That was a little bit early on. And again, I moved from Egypt, so I came here on a working visa. A little bit later, I got my permanent residency. I wasn't going to apply for what I couldn't afford applying for specialty training unless I'm a citizen. So all of that kind of fell well in terms of time, because by the time I was done with my MGDF and then the fellowship of the Royal College, I then got my citizenship, and then I could apply for basically the specialty training, being a citizen, and can get a bit of what do they call it? HECS? Yes.
Mm-hmm.
The HECS. Yeah.
So then you apply for the postgraduate degree. I mean, you're applying at just one university, you're applying at multiple different universities and seeing which one takes?
My experience was, I was lucky. I applied for Melbourne University. I wanted to stay. It would have been a bit more difficult if I'm to move, because my partner wouldn't have been able to move. So I think I was lucky that I applied for one university and I got in from the first trial. But I can totally see the merits of applying in different centers, different training centers, different universities. And this is the advice that I give people who would speak to me now, like, what should we do? And it's like, keep your options open. You want to make sure that you're not kind of putting all your eggs in one basket kind of thing. So spread the word out that you want to get in, and by putting applications in different centers, and hopefully you get into one of them. But in my case, I applied to Melbourne University, and again, I'm very thankful because it was I was a bit lucky in terms of, by the time I wanted to apply, or I got all my paperwork ready and everything, the application process actually closed. Like, the application window has closed for the following year, and so I was in 2015, and I missed the application window, and now 2016 is gone, and now I'm talking about 2017. I'm sitting one day at home for no reason. I thought I will just jump onto Melbourne Uni website again and again. I don't know why, what came to me at that point, and I'm jumping there to look up, and suddenly I read that the Department of Prosthodontics is opening a second round of applications. I've got no idea. And we're in October, and the academic year starts, October. No, I think we're in September. The academic year starts in 3 or 4 months, the next year. And they've opened a second round of applications. I've got all my paperwork ready, so I submit on the spot. I get shortlisted, I get interviewed, and I hear back from them all within the vicinity of 8-9 weeks.
Wow.
So suddenly I'm starting postgrad studies in 2 months, and I gotta finish the case that I'm working on. I gotta put my notice because I've been accepted. So again, very thankful to my stars. My mom was praying for me probably back home because things actually gone very quick for me, the way I wanted, basically, except that I missed the application window the first time. But there you go, pros opened the second round of application just for me.
You just never know. Hey?
Exactly. When your stars align, it works for you some miraculous way.
Yeah, I guess would you say now, if you didn't miss the first round, if you missed the first round, but you're still interested, would you say just to let the university know that you're still interested? Or like you said, you had no idea and you just decided, I'm just going to open up and have another look.
Yeah, but I've already gone to the university. I've made contact with the head of the department at that point, Roy Judge. I went and spent a day watching over the shoulders of the postgrads that were doing their training at that point. I've spoken to my references already. I've given them a heads up that I would like to get in. So I think I've done all the kind of the laying down the work. Okay, it was just about the application window that I missed. But I don't think if I haven't done that, and suddenly I'm this short period of time with a kind of second window or the second round of application, I wouldn't have been able to, again, get your references lined up, go and make an appearance, because you don't want them to see you in the interview if you got shortlisted. You don't want to see them seeing you for the first time. So
you don't want a cold call.
There is a little bit of work that you do pre. So I'm signing up for the Prost Society. I'm attending meetings. I'm making myself visible to the people who will make that decision at some point. So they kind of know of you or know about you by the time you come in for the interview.
Yeah, I've talked to other colleagues as well, and to their point, if you're looking at specializing, that's exactly what they say, Dentistry is a small community, and it's a simple reach out, and they're very welcoming in letting you in.
Yeah. And that's the thing. So you want to have those, not connections. I'm not saying you're going to ask favors, but you want to have those connections and have those discussions and hear from other postgrads about their experience. Because again, everything adds up to paint the picture for you as clear as it could be, because again, there's always a surprise when you're in it than when you're hearing about it from outside.
Which is actually what I'm going to go to next. So, all right, you hear about everyone's journey through their postgraduate, their specialist program. What was the most challenging part of the specialist program, and how did you overcome it?
I think that you don't know what you don't know. So again, naive me, I thought, it's pros. I'm going to go in there, and from day one, I'm going to be preparing crowns. Only to realize that the first crown prep is probably 6-7 months in. Okay, because you've got all the work that you need to do, the diagnostics, the lab work. So I think for me, the biggest challenge getting in at the beginning was the amount of lab work required. So in pros, we do a lot of lab work ourselves. So all your wax ups, all your mounting, your articulation, your denture work, setting up of teeth, all of this you do yourself. So for every 3-hour clinical session that you're doing, it translates to good 5-6 hours in the lab afterwards, because you're happy with yourself. You just prepped, 3 to 3, and you've taken an impression. Now you have to pour dies, trim dies, ditch the dies, marginate them, articulate, have everything ready before it goes to the lab. The lab is just doing the final part. And you've done before that, you've done the wax up, of course. So the amount of lab work was enormous.
This reminds me of like an analogy in the kitchen, when you see the chef, cooking, but all the prep work, he's all done all that prep work behind or throughout the day. You don't see that. You just see him, doing, the woks on fire.
And that video, that 10-minute video of just the meal coming together.
Yeah.
Okay, it's a trap, because I fall for that trap. I look up videos for new recipes, like, oh, that looks easy. It's because I haven't seen the prep work. And it's the same thing here. So I walked in, I didn't know much about what's involved in terms of how intense the course is and the hours required. And that was a little bit of a shock for me, that it took me a good year to get accustomed to the long hours and going back home at 9, 10 o'clock at night, and then starting an early day the next day straight away. But again, I got to give credit to the group that I was with. In my year, Dr. Carolina, Dr. Charlie, we ended up being very, very close. And that kind of helped, because it can make a huge difference if you actually get along and you're kind of good friends with the group that you are spending, good 12 hours every day sitting side by side in the lab, plus in the clinic, of course. So with them being there and basically feeling that it's not just you who's having a hard time, or who's struggling, or who's making mistakes. You're seeing that also happening, on the bench next door. It makes you just kind of able to persevere a bit more.
So that's how you kind of overcame it. So what was the most interesting case that you've ever worked on, and what did you learn from it? Doesn't have to be during pros, or it could be after, like.
Yeah, look, I think we all, as dentists, and I think everybody shares this view, that we're very fortunate in the kind of the work that we do, and how we can see the immediate impact of our work on patients. And every dentist out there is gonna feel this, whether it's actually a one tooth, a full mouth rehab, or getting patient out of pain by doing an endo and extraction. I think it all kind of gives us this immediate gratification once we finish the work and it turns out nice. In my case, it was actually a case I've done during my training. And I think the complexity of the case, or why it meant more for me, it was because it was a rehab of a cancer patient. So you really, really see the impact of the work that you've done in terms of the quality of life for the patient. So that patient unfortunately had an aminoblastoma.
Yeah, it's very big.
They had a reconstruction of the mandible with a fibular graft from the leg. And I mean, nowadays things kind of changed in terms of with the digital workflow and digital planning, things can actually happen faster. And I've seen amazing work from prosthodontics out there. Dr. Gordon Burt, for example, he does a lot of work with the cancer patients in terms of what they call teeth in a day. So the fibular graft and the implants and the teeth are going in on the same day. That wasn't for me. That wasn't in my case. In my case, the patient has been on a liquid diet for 2 years because they've got no teeth at all in the bottom and some teeth at the top. And so doing the kind of the implant rehabilitation for her, not placing myself implants, but having the MaxFax place the implants, and then having a bar over denture, and how massive she changed, not just from the looks, from function, but even the looks. And she was such a nice lady, very appreciative. She would come back every time I'm seeing her for a review. She's coming and tell me, what did she eat in the last week? Because all of those things, they were just kind of dreams. She wouldn't be able to eat any of them. Everything was kind of, blended together, and it's like a slush of food that she was having. So I think I still look back at those pictures, and I still use her pictures and cases in presentations, because I think I was fortunate to be, to be the one who treated her. And of course, alongside the MaxFax people who've done, they do miracles over there. we ended up seeing the impact of the work that we do.
Yeah. Wow, that's incredible. It's always that, how you've changed someone's life, that's the one that leaves the biggest impact on you, hey?
And it doesn't have to be the full on, max fax cancer case. You can see that you've changed life for a young patient who doesn't like the smile, with a bit of direct composite bonding, and then suddenly they get the confidence to smile more and show more of the teeth, and that is the kind of the same impact, just different people, different mindsets and everything, but it's almost the same kind of gratification that we feel as well. So it doesn't have to be, the high end of implant dentistry. We can still change lives with as little as just a little bit of direct composite bonding on teeth.
So you come out the other side of the tunnel of the specialist program, right?
Yes.
Did what you expect differ to what actually happened?
I mean, after the life after?
Yeah.
Look, in terms of the work and the cases, again, I think we see the most complex cases when we're working in the public sector. So when you're doing your training, and in my training, we're doing the training through DHSV. So we're placed in the Royal Dental Melbourne Hospital. So you get all those kind of very complex cases through the hospital that otherwise you would not see in private practice. And I think that was one thing which is great about the training. You're trained to treat the most complex, but then you walk out and then suddenly they're like, oh, it's not as complicated as it was at uni. And I think that's like a little bit of a, it's a bit of a relief. Not that you can't manage them, but it's not all like this. Okay. You get the complex case every now and then, but at uni, I think it's meant to be that you get all those kind of, complicated cases that come through the hospital. The thing that you didn't get kind of a heads up for until you're working as a specialist is the amount of paperwork, the amount of letters, reports that have to be sent out, and for every patient that you see, and for example, if I need to refer them to another, specialty, like we're going to get a root canal treatment done, or we can do a periodontist. Now suddenly I'm writing a report for that specialist. I'm writing a report for the general dentist who referred it to me, and I'm probably writing a report in a kind of a lay terms for the patient themselves about the treatment plan and options and a quote and stuff like that. So then you realize that for every patient you're seeing, or every new patient, there's at least 2, if not 3 letters needed to be typed and sent out. So I think we all get so excited about the work, but we don't think about the amount of paperwork that comes sticking to it. Yeah. So that was a little bit of a surprise. And then suddenly you have to allocate time for this. Whether you're going to be sacrificing your lunch break, you're going to stay behind a little bit later at the practice, or you're going to do it in the weekend, in the morning when the rest of your family is still asleep. So you have to come up with a time to do the paperwork required. Wow.
You can't put it on a dictaphone and then send it to someone to type it all out for you, hey?
Some people do that. I'm not there yet. Okay, so I've seen some of my mentors when I was kind of shadowing them during my training. I would go and spend a day, and I've seen people who, I've seen Dr. El-Haddad, may rest in peace. He was able to dictate it while the patient is in the chair and he's looking at the OPG. So he'll have the OPG up, he'll have the patient there, and then he'll be looking at the patient, and he's not dictating the notes to the nurse to write down, or some charting. He's basically dictating the letter, because everything in his head, being in prosthodontics for 30 plus years, everything in his head kind of makes sense. So straight away, it's coming out very flowy. I tried the dictating softwares, the software dictated and then type straight away for you. And because I need to write a letter, and I think about it, and I do some umming and ahhing, and those kind of non-words that software doesn't like. So maybe at some point I'll be able to, but for now, I still write my letter and I kind of go through it again, kind of as an editing, kind of a go proofread it again before it's sent out. At some point, if I get too flowy with my letters, then probably I can resort to one of those softwares, but not yet. So now I've got to do the hard work.
You just need to control find all the ums and then just delete them all. No jokes. So obviously the reason why I also asked you that question is because interestingly you worked in Tasmania and in Victoria at the same time when you graduated, right? So how was that? And I would have thought people would have just stayed in the one place.
Look, I got to be honest. If I came across the chance to work in one place for the whole week, I'd have taken it. Okay, but I again, as a prosthodontist, we were told when we were close in training, we were told it will take you 1 year outside to build a day of patience. So for every year spent outside, then you can build the second day and a third day and so on and so forth. And you think that maybe that person is a bit too pessimistic. Maybe I'm different, but it is what it is. You walk out, and as a prosthodontist, you got to build a name for yourself, and you need people to know you, to refer to you, of course. So my first job in Melbourne here was a 2-day job, and I wanted to fill a little bit more of my week. So besides a bit of teaching, I decided to do this kind of fly in, fly out to Tasmania, to Launceston, basically. Tasmania is a beautiful place for a place to live even. I didn't get a chance to relocate because, again, I was based in Melbourne. My wife's here and her family and so on. But unfortunately, Tasmania doesn't have a prosthodontist base there. Okay, all the prosthodontists who serve Tasmania are fly in, fly out. There are people from Adelaide who go to Hobart, and there are people from Victoria, from Melbourne, that go to Launceston. And I was one of the 3 people who used to alternate and go to Launceston and do some work there. So I was there every 3 to 4 weeks. I'd spend a day or two seeing patients over there. And I wasn't ready to give it up. It was just COVID. COVID hit, and Tasmania was very strict about the rules. Australia was strict, and then there was Tasmanian strict. That was they completely locked themselves out, and so I had to go to sleep at night knowing that I've got temporary crowns in patients' mouths that are not going to receive the final crowns until the borders open. So it was either sending the work to a dentist, the local dentist over there, who can kind of insert it for me, or patients who are willing to wait. And the question was how long my temporaries are going to stand the test of time. Luckily, for a lot of them, they stood the test of time. And when the borders opened, I was able to go back again. But at that point, Melbourne has kind of really picked up for me. And I got my hands in a few, my fingers in a few pies. And that meant that I needed to kind of cut out on a few things. And unfortunately, Tasmania was one of the things that I could not continue doing. So I've wanted down a lot of my days that I do there, starting at the beginning of this year. I think I've got maybe 1 or 2 more visits, but it's mostly Victoria from now on.
I can only imagine your wife being like, I thought we were done, and you're still going, you're still flying.
I would sometimes kind of bribe her by, let's make it a trip. So I'm working Monday, Tuesday, let's go to the weekend and spend a weekend there. And she grew up in Tasmania. She now has moved here, but she grew up in Tasmania, so she's always happy to go back for a visit. Yeah.
So, you've mentioned a fair few names, who's been pivotal in your career path for various different reasons, Is there any one in particular you also want to give another shout out to that you haven't already mentioned? Not to put the pressure on.
Look, it'll be hard to mention a name. I think, again, I was lucky that I had the opportunity to, before even getting into the program, getting in touch with a few prosthodontists who were happy to have me over, discuss what they do, kind of get a better understanding of what being a prosthodontist means. It'll be very kind of hard to just put it all onto one name. I mentioned a couple of names, and I put on top of that Roy Judge, the head of the pros, when I was doing my training. I'll put Tony Rotondo. I think he's a person that a lot of dental people in Australia look up to. Mm-hmm. He's a great clinician and an amazing kind of teacher as well. Yeah. I think
that's okay.
I was lucky with the people I worked with and learned from.
Yeah. You've mentioned some struggles already in your journey so far, right? But have there been any other struggles that maybe some of our reviewers also might not have known about?
Okay, so some people know about that because I'm not I'm not afraid of mentioning it, and I mention it to my students and postgrads who join the program. When I joined pros, I had zero experience with implants, whether surgically or restoratively. I was kind of more focused on what I was doing in the practice I was working at that point. So this was the CPD that was kind of keen to join, and the skills that I need to, or I'm keen to, to sharpen. Because the practice I was working at, they weren't big on implants. I kind of missed the opportunity of learning about implants before I joined the course. So when I got into the course, I felt like I'm a bit behind. I'm joining with people who have either placed implants or restored implants or both. One of my peers in the program have done the grad dip, the implant grad dip at Melbourne Uni. So there was a lot of implant experience amongst the group that I was part of, and I was lacking. Yeah. So that was a struggle at a good first year, is that I had a lot of catch up to do, which meant a lot of reading back home, and we involved from day one with a bit of teaching for DDS3. And I know that the implant component isn't as extensive, but it's still, from me, it required a fair bit of pre-preparation, so I know what I'm talking about. So I think that was the biggest struggle that I had in my first year, is feeling a little bit behind and feeling that there's always a bit of a catch-up that you want to do just to be on the same level as people that you're in the same year with. But again, and I tell that story to postgrads who just joined, so that they don't feel that because this is the feeling that you get once you're into postgrad, like, oh my God, there's so much that I don't know. Is that you'll have plenty of time to learn, as long as you put in the effort, and a lot of people around you to help. So just the fact that you've joined postgrad and you don't know this or that, you'll all end up knowing what you need to know and learning what you need to learn. But it's just that you need to put a bit more effort than the person sitting next to you.
Yeah. So, I mean, you've mentioned it here a little bit there already, because a lot of graduates want mentoring, but they interpret that differently. So what are your thoughts on recent graduates looking for mentoring?
I think it depends on how this person feels comfortable in their mentoring. So, for example, a recent graduate might feel that what they need is shadowing, watching over his shoulder, doing the work and asking questions on the spot. Somebody else might be more about they need the hands, not literally hands held, but they need more kind of mentoring or direct mentoring. Some would be wanting just a chance to chit chat about the case before the patient comes in, so that they can get their kind of the ideas straight in the mind. So I think the fresh graduate, or the kind of the green graduate, needs to kind of talk amongst themselves, talk to themselves, realize what is it that I'm after, what sort of mentoring am I after, and whether that means that do I have to be working in this practice next to that mentor, or could it be somebody who works more remotely in another practice, but I can visit, or I can bounce ideas off, over a coffee on a weekend or something. So I think it depends on what you're after, and then from there you can see who's happy to give you the kind of mentoring that you're after. I myself was more of a shadowing person. I'd like to be in the room. You do your thing, I'll just watch over. And I won't try to interrupt, but I'll wait for the patient to be out, and then I'll ask you questions about what just happened. And that was, for me, was very helpful before postgrad, and before postgrad and during postgrad, and note taking. That was my kind of mentoring that I wanted, and I was glad to have a lot of people willing to do this. And in the same way, and giving it back, that's also the thing that I'm happy to do for people who are happy to come and watch. I'm like, yeah, come and watch me. I'm happy to do that. Or we're happy to do any treatment plan discussions and treatment plan mentoring. That's also another thing that I really enjoy, sitting, with an OPG, a few models, a few pictures, and then just discuss it all.
Well, if after today you get a whole bunch of DMs, you know what's happening. You asked for it.
You know why.
No, okay, so you're an academic lead for the CPD at Melbourne Dental School, right? That's an exciting title. But what does that involve, and what achievements are you proud of so far?
So that's a role I took on in the either right before COVID or as COVID started. Okay, so it wasn't the nicest kind of start for a role like that, because suddenly all our ideas of how to run CPD has changed, and we had almost a year of just kind of online, canceling a lot of things, rescheduling a lot of things, but also online webinars for most of the CPD that we were able to deliver during that time.
Yeah, I saw a bunch of lights. Hey, you had all these light setups, the mannequin and everything.
And it kind of it's one of the things that actually kept me sane during COVID, because you know how dentistry got impacted big time, but we don't deal with a lot of emergencies as prosthodontists. Mm-hmm. So I actually had very little clinical work to do during the kind of the strict lockdowns. But it was actually that role of the CPD academic lead or CPD director at Melbourne Uni that kind of kept me sane, because it kept me busy. I inherited a calendar that Melbourne Dental School kind of tends to run. And from there, we started looking among the CPD committee about how can we make it better? What courses need a bit of zhuzhing? What courses need to be dropped out? What new courses can we add to the calendar? What are people interested in? And how can we? And I think people also realize that I can do actually CPD from home. I don't have to take time off work, okay, and the income that lost during that time of doing a CPD. So we started kind of at least having a hybrid kind of setup for all our courses. So you don't have to come and sit for half-day lectures, for example, and then half a day hands-on. What if we are able to deliver all the lectures on online, like all the content, all the didactic content online, and then you can just be coming in for the hands-on, which kind of saves our attendees time that they take off work. But also, we found a lot of positive feedback from doing on the didactic content online, because they can listen to it in their own time, kind of digest it at their own pace, and then come up with questions. So this was we kind of realized that this is a nicer setup for delivery of the CPD courses. So that's been our main challenge, is to get to our demonstrators and people who deliver the CPD content, and then ask them to record things, and then it's edited, and then it's kind of uploaded. So it's just the kind of asking for favors, because usually that would be our CPD provider coming in, giving a lecture, and now I'm asking them to pre-record and then assign a time for an online Q&A. So there was a lot to ask our providers to do for us, but luckily they were all very helpful and very understanding of the change in how things are going to be done in terms of CPD delivery.
Yeah, I mean, I just remember the time when, lectures you had to physically attend, and then the lecturers themselves were like not really for being recorded because it would affect attendance and whatnot. But to your point, and now after COVID, it's kind of accepted, and yes. It does, in one way, I mean, put more pressure on the person themselves, like the student themselves, or the dentist themselves who's attending, to actively go and learn. No, we're not going to be spoon feeding you anymore.
Yes.
To really get the most out of it.
Exactly. And again, it's we're trying to help in today's economy. Again, is to try to limit the amount of time that you'll miss at the practice. Because we all know not all CPD courses can be run on a Saturday, Sunday kind of thing. Sometimes they will be on weekdays, and so it's all about how much time are you going to lose to gain CPD.
Yeah, exactly. I think you've hit the nail on the head there, because you've experienced it too, and a lot of when I speak to colleagues as well, they have the same kind of issue. Do I fly interstate to attend this lecture that's gonna have to figure out accommodation, yes. The flights there beforehand, so I'm not taking out just the CPD dates, but also maybe the day before or the day after.
Yeah.
Exactly. And then with people nowadays, when they're so committed to so many different other things, family or whatnot, that also adds an extra burden. So, that's great to hear. So I'm looking forward to hearing about those VR headsets and smart glasses for those implant education. Okay?
We actually had a trial on them. So that was through ITI and Straumann. So we I think we had a run. We had to just kind of play with it. But I think Straumann now is running kind of a multi-center study So it's an implant course, but they will be kind of doing it two groups of people. One group will be getting the normal kind of, education, and the other ones on top of the normal education, normal lectures, they'll be getting the smart glasses and the VR. And we're trying to see if that would actually impact the learning outcomes. So how the learning objectives can get through to two groups, and how can those small extra gadgets add to the learning outcomes, and whether we can have a proper kind of idea whether actually all this kind of fancy gadgets, do they add really to the value of the learning or not?
Yeah, I mean, I've seen like the machines where you put your hand underneath some sort of camera that kind of vibrates, and it feels like you're really cutting into tooth.
Really? Yes.
Yeah, exactly. And from the colleagues I've spoken to, and they've said that it actually feels like you're cutting tooth to a certain degree.
I haven't had a chance to work with them. I see, because Melbourne Dental School has one of those, not one, it has actually few of those. It's like 20 or something, that they have those 3D drilling machines, if we can call them.
Yeah.
And luckily for them, I think DDS 2, they get a chance to practice on them. I kind of walk by, and they're all wearing those kind of glasses, and they're drilling in nothing. They're holding thin air, and doing this, but
yes.
It looks exciting. But I think this is where technology is going, and we're just adapting, and we're using technology in our favor, not just in treating patients, but also in educating young dentists.
Yeah, it's a crazy time to see. Looking forward. So a lot of our listeners are young and hungry dentists, as we've just mentioned. Who are aiming to achieve large goals. I want to ask you. What does success look like for you in the future?
For me, for the future, I think it's about the balance. In my head, it's always about the balance, because again, you don't want to kind of go into one tangent forgetting the other. So I mean, success can be your patients, of course, and busy seeing patients, your business, your family, your personal life.
Yeah. But what's success for you?
Your headspace.
Yeah.
For me, it's the balance of all this. For me, I'd like to be working 4 days a week, so I can still give 3 days for my family. My wife and I we're trying for kids, so we're trying to get a family now. So I know that this is going to be something that I will need to maybe make myself less available for work and more time given for the family, which I don't have to do now because we're not looking after little kids, but we will hopefully at some point. So for me, it's about that balance. If I'm working 4 days a week in clinic and I've got 3 days completely off without having to do paperwork during those 3 days, I think that is a very nice spot to be at. I don't want to cut ties with the university. I don't want to lose my the teaching part that I do. So I still enjoy my relationships with BDS students. And again, I think it's like I had a lot of respect to my demonstrators, because I know that they're giving up, precious time of theirs to be there and teach us. So that's what I want to do back. So this is usually the balance that I'll be looking for in time to come.
So to wrap it all up, I mean, there's so many questions I want to ask you, but just to wrap it all up now, do you have any wise words of wisdom for the budding young dentist? And, what do you think the key skills or attributes that they should be focusing on developing?
Well, I think, and this is coming from personal experience, it's about not kind of, don't act like a lone island. You're not an island, okay? You're part of a big group of people, like the students or like your group of peers. Learn of each other, okay? That trickling effect, okay, from different, from one clinician to the other, or from one student to the other, really helps. You don't have to make all the mistakes, okay? You can only do, this bunch of mistakes, and then the person sitting next to you is going to do the other bunch, and then you're learning from them because you're watching and you're talking. So I think talk to each other. There's nothing wrong about making a mistake as long as you can learn from it, and really talk to your peers. And the peers are not just the people in the same class or the same group, but also the older ones. So I mean, postgrad learning or postgrad kind of setup is made that way. We're sharing the same space with the second years and third years as the first year, because there's this kind of trickling down effect. So before you go to your demonstrator and asking them questions, you were basically asking each other first and learning of each other, because probably somebody has seen a case similar to yours, and probably they kind of stuffed it somehow or some way. And then you're learning from them, so you're not repeating the same mistake. So for young dentists, talk to each other, learn from each other's mistakes. The more you do, the more mistakes you make. It's part of life, and that will just continue with you. It's just about how you deal with the complication. So in my head, you always want to start a procedure if you're able to either finish it or you can deal with the complication. So I think, and I think that was kind of taught to me, and I kind of always have it in the back of my mind. And maybe that was why I joined a specialty training, is I wanted to be very comfortable in doing a few things, not everything, doing a few things well, and being able to manage the complications when they happen, because they will happen. Complications is just part of life.
Yeah. So, Dr. Hossam, thank you for coming on the show today. If you could let the people know how they can find you.
So I'm very contactable via Instagram. So Instagram is part of our daily life now. It's a big learning, teaching platform, dental platform. So I'm pretty sure in the description of this video you'll be putting the kind of Instagram page. But yes, please message me if you've got any questions about my trip through dentistry, or about pros if you're interested, and I'm more happy to answer that.
Yeah, definitely. We're going to leave it in the show notes below. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.
Thanks, Laurence. Appreciate it. Thanks for having me.